trained residents who can help people navigate through the system, because a lot of times when people get involved in healthcare systems, they have other stuff going on and they don't know how to go through the system. And they get swept underneath the carpet and they don't get the help and the services they need. So you need a point person called patient navigators. That's a new field. Okay. Along with this, you can streamline billing, access the process. People know, I don't know if any of you have ever been in the process and you get these crazy bills and you don't know what's going on. Or if you've got parents, they on Medicaid and, you know, retirement, they got these crazy bills, they don't know what's going on, they take money from here, there, wherever. You need somebody who knows how to deal with that. You need a streamlined process, which the federal government supposedly is working out. We'll see. Good luck. The next one is prevention around social determinants. We need prevention education, as the gentleman said. 4% of every dollar is, 4 cents on every dollar is spent on prevention of stuff that would stop a lot of these chronic and acute diseases. Food access, people don't have good food access, so quality food access. Environment, well, we all know about that. If you live in a toxic environment, with toxic people, toxic waste, toxic food, your life is going to be toxic. And do they have their basic primary needs met? Do they have a place to live? Do they have adequate clothing? Do they have adequate shelter? These are issues that have really come up for the bottom half of the society, particularly in the last 4 years. And in many instances right now, they're not being met. Equity is what we're talking about, basic necessities in terms of access to money, that kind of thing, jobs, education, standard stuff. Which leads us into our last one, skill acquisition process. What we found, what we talked about is a lot of poor people need not just information, they need skills, which is how to take knowledge and use it. They don't just need information. Well, you can apply for that job on the computer. I don't have one. We'll go to the library. Well, yeah, it's 50 people ahead of you to use the computer. Right. And you can only be on it for a half hour. Y'all know what I'm talking about. Right, yeah. Depending upon where you go. Right. You know. Yes, sir. But those are the things that they need to know. Who are the people I can go to to tell me how to do this thing, how to use the internet and all of that. Technical skills, life skills. We got young people who, you know, I work in schools who have issues. They don't know how to talk to each other. They're learning that, but the adults don't know how to talk to each other. We're talking now. Exactly. So they need to know basic other skills. Where do I go for help? If I have a social or a psychological or a physical issue, who do I go to? What do I do? They don't know. They don't even know that there's somebody they can go to. They may not even know that it's a problem. Okay, jobs. Well, that speaks for itself. You know, we need to know how to get jobs, what are the skills I need to get a job. Because getting a job is a skill. Knowledge base. They need to know that there's a base of knowledge in the community and how to use it. There are services in the community many of us have no idea about. And that's one of the problems. We don't know. We don't have the knowledge. When we have information as opposed to knowledge, we still don't know how to use it to get what we need done. That's basically it.